technology workforce. So joining us today for the session, we've got Rafia Badat joining us, although we're just trying to get her in at the moment, so I don't think she's on the call just yet, but we'll get there. We've also got Rennie Devlish, who is one of our principal analysts within population health management. We have David Harris, who is Senior Equality Advisor. We have Elspeth Griffiths, who is our Director of Human Resources and OD. I'll just give a minute to let Elspeth wave. We have Michael Knight, who is our Informatics Portfolio Director. Great. So thanks for joining us all today, and throughout the session we'll be getting everyone on the panel each in turn to share some of their experiences. If you would like to share a comment or your thoughts on the topics we're discussing, you can post these to the Q&A feature, which will be to the right of your screen. If you can't see this feature, you should click the Show Q&A button, which is at the top right of your screen, and you can also make comments anonymously if you wish to do so. You can add subtitles to this event by using your captions and setting buttons on the bottom right of your screen. We'll be posting that in the text as well, just to help people who might need that. And finally, we are recording the session and we will share this after the event. You can also join in the conversation on social media about all the events this week and this one using the hashtag SCW Digital. Those who know me, I'm a bit of a Twitter addict, so please get involved in the conversation and it'll be great to keep continuing this. And I'm now going to introduce what we will be talking about today. So why this session came about. Personally, I've been working in the informatic digital space for about 7 years. In a variety of roles, and I'm currently working largely with Health Education England actually on the Digital Readiness Programme, focusing on the expansion of the NHS Digital Academy. My current work means I get to explore a really interesting intersect where digital meets workforce meets EDI, which is really exciting. So when we started to scope out the SCW Digital Week, I was really keen we did a session that was focused on diversity. My personal experience in the digital space is that there can be a lack of diversity. It's not been uncommon for me to walk into a room and be the only woman or the only woman of colour, especially as I've got into more senior roles. And my anecdote is not, not uncommon or unsurprising if we were to look at other stories and other evidence, including ESR data. The impact of not seeing anyone around you who looks like you can sometimes be a bit intimidating. So I want to use this session today to explore some key ideas with a great panel. And this will enable us to explore a bit why diversity is important and what we can all do. So the objectives for our panel session today are: 1, to promote and increase dialogue around allyship and diversity and inclusion within South Central and West, but also, any of the external audience who have joined us today, you're more than welcome, and great to share this learning with you. And today's session will in particular focus on supporting women of colour. Secondly is to reflect on some of the challenges we have and use this as an opportunity to develop some actions. And thirdly, look at how can South Central and West spread initiatives such as the Shuri Network, both internally and externally, with the organisations we work with. So I'm going to start off with a question to our panel, and I'd like each of the panel to please introduce yourself with your name and your job title. And then can you please also share why you personally feel the EDI agenda is important for those working in digital data and technology? So over to you first, Preeti, and then we'll keep the camera going in the order.
Good afternoon all. My name is Preeti Sharma Mehta and I'm a Senior Project Manager in CHAI team working in South Central and West. I have a story for you. In March 2019, NASA had planned an all-female spacewalk, and that event they had to cancel at the last minute because they didn't have sufficient spacesuit that would fit a woman's body. NASA learned from their mistake and then they rescheduled that event in October of 2019. But when we work in digital and healthcare, where our patients come from all diverse backgrounds, and when we design the solution, digital solution and technological solution, we don't have luxury to learn from our failures. And when things don't directly impact us, it is easy to forget about other groups. And that's why EDI agenda is very important to us in digital data and technology. Thank you.
Renu.
Hello. Yeah, thanks for the introduction, Asha. I'm Renu Dublish, and I've got about 20 years experience in NHS, but as you can see, I'm not that old. I'm pretty young in my thought process, but I was a population health management principal analyst till last week, and I've taken up a secondment role to be a shift manager on the immunization management service, which I started last week. And I've also been appointed the BME lead for Eastleigh location, and I've only had one meeting with that. I'm really looking forward to being a part of that group. And as such, I've never had an good or a bad experience personally, but in general, I feel that to have a diverse workforce is quite important in any aspect, whether it's digital data technology or any other. It's very important to make people feel they are included. And when you have a diverse workforce, you get asked very different sort of ideas as well. And the only experience I can share is someone else's, who was in the IT department, worked with me, but she was very reluctant to take on any new work because her kind of past was scarred. She was from a BME background, but she didn't feel that supported. She was stalked, and that kind of filtered through in her work. She lost all that confidence in contacting people outside the BME group, so she needed that sort of support. But I think it's very important to have that inclusive workforce. Thank you.
Thank you.
Thank you. David, next, please.
Thank you very much. Good afternoon, everyone. I'm David Harris. I'm Senior Equality Advisor at South Central and West Commissioning Support Unit. Like Renu, I'm not quite as young as I sometimes appear. Of course, I'm going to say that equality, diversity and inclusion are important in every area of the economy and social life. But in terms of digital data and technology, we have an opportunity to rapidly improve the way we deliver health services. And when I first joined the NHS, I was in public health, so I'm quite interested in public health and health inequalities. So the risk with all these opportunities is that we improve health services best and fastest for those who already have the best health outcomes. This is, if anybody's ever read the Professor Marmot's review, this is called the law of inverse proportions. Now, if we aren't to inadvertently sustain or widen health inequalities, then this field of opportunity that we've been presented with has to prioritise the needs of the digitally excluded or the digitally less enabled. And research is showing that those most likely to fall into these categories include, amongst others, women and people of colour. So who better to be leading us in designing and implementing inclusive digital solutions than women of colour?
Thanks, David. And over to Elspeth next, please.
Thanks, Asha. So, hi, I'm Elspeth Griffiths. I'm the Director of HR and OD at South Central West. So, in terms of the question about why it's important, diversity as a whole is something that, as an organisation, we are acutely aware of. Is we do not have as diverse a population in our workforce as we would like, particularly at senior levels. But other work that we're doing within the organisation is to identify in service lines, particular service lines, where we have a disproportionate effect of diversity. And I think, well, I'm pretty certain I know that digital and technology areas in terms of our informatics and services is one area where we are definitely lacking in terms of diversity. And as David has articulated very eloquently, as have others, it's really important for us to have a joined up approach and to understand how people are affected impacted, and we can only do that by having a really inclusive approach, and that means that increasing our diversity and having positive action to be able to do that is really important. So whether that's about gender, whether that's about ethnicity and race, whether that's about disabilities, it really needs to be as inclusive as possible, and that's the work that we are looking to take forward. And we've got some way to go, but that's clearly what I'm focusing on, and what I'm what I would like to see us developing within SCW. Thank you.
Great, thanks Elspeth, and over to you next please, Michael.
Hi, my name's Michael Knight. I'm an informatics portfolio director at SCW. In terms of the importance, I think it really touched on kind of 3 areas for me. So firstly, it's about creating an environment for our people where they can do their best, and making sure that they're comfortable doing their jobs, and also doing new things and taking up new opportunities. And so that's really the second thing, is about the kind of equity of opportunity, and making sure that's spread across our team. But I think most importantly, it's about quality of outcomes. We provide services for diverse populations. So if the team that develops those solutions doesn't reflect that, then we're clearly missing opportunities to provide better services. But that can then flow into things like data and algorithms. And I think we've all seen around the A-level results saga exactly what can happen when we don't get those sort of things right, and we aren't diverse and inclusive in our thinking. And from a personal perspective, and as someone that kind of grew up in a single parent family, I really kind of viewed how people from certain backgrounds appeared to be disproportionately impacted by that algorithm. And then that really kind of felt for me like a punch in the gut, and that really for me has kind of played quite a significant part in my education around this particular area, because I think ultimately discrimination is discrimination, irrespective of the kind of the category that sits behind it, and we can't pick and choose as a society. And I really see, as part of my role of a leader, is being able to ensure that we are as inclusive as we can be, to provide the best outcomes for our populations and best opportunities for our people.
Thanks, Michael. So we're just trying to get Rafia on. So what we're going to do is we'll move on with some of the other questions, and then hopefully we'll get her and we can do an update on the other bits in the Shuri network. If not, I'll talk a bit about the Shuri network at the end of the call, as it's really important and we don't want to miss that. So moving on to the next question. In your career, have you been able to identify with people similar to yourself in leadership positions? And do you think that this has had an impact on your own career progression? So over to Preeti first, please.
I've been very privileged to work with a lot of women leaders and learn from them. In Brighton and Hove City Council, where I worked, at one point of time, we had most of the head of the department who were women. I have to say, none of them were women of color, but we had CEO, CFO, all women, and I learned a lot from them. However, I draw my inspiration from Indra Nooyi, the CEO of PepsiCo, because something she said in an interview which stuck with me. She said that she had 3 strikes against her. She's an immigrant, she's a person of color, and she's a woman. But she still made it to the table. She had to work hard against all odds, and she made it to table. So that's what I learned from her story, that if you have skills and experience, you may have to work harder than rest, but it is possible. Thank you.
Thank you. And Michael, over to you next, please.
So clearly there are a fair amount of people around the senior leadership table that will look very much like me. But in terms of kind of where I've been looking at exec teams, certainly in the early part of my career, I didn't really kind of consider necessarily that people had a similar background to me in terms of the way that I kind of grew up, I guess, and so, but there was one person in particular, Rob Shaw at NHS Digital, and the way that that Rob spoke and led his teams, I really saw something in Rob that kind of inspired me as a person who I could kind of who I could look up to and hopefully kind of follow in his footsteps. I would say in terms of opportunity and progression, it would be remiss of me to say that that my background has had an impact. I've progressed fairly quickly with my career, but I would say that I've kind of perhaps built a persona in terms of how I engage with people, certainly more senior people in the organisation, based on perhaps what's expected of me, more so than reflecting the person that I am. And I think perhaps if there had been more role models that were more similar to myself in background, then I may have perhaps done things slightly differently.
Great, thanks, Michael. And next we're going to go over to David, please.
You're on mute, David.
Sorry, can you hear me now? Yeah, sorry, I apologise. I knew I'd do that. Okay, so first of all, I have to admit that I'm not based at the moment within the digital sphere in terms of my role. My role is in equality, diversity and inclusion, and before that, it's been in a range of social policy roles in local authority and housing associations, and before that I was a building surveyor. However, since joining the NHS in about 2006, 2007, I suppose the answer is that no, I haven't seen myself reflected in senior leadership within the NHS. I have been able to identify with people outside of the NHS, and luckily my role does often bring me into contact with people outside of the NHS, or even within the NHS, but not necessarily within my organisation. And the impact that this has had is, I've got to say, it's usually been women. So I've been fortunate enough to work with lots of women of colour, and women who are used to butting up against barriers and challenging those barriers. And they've helped me to develop a more can-do attitude than perhaps is natural for me. And they've also actively encouraged me to go for certain opportunities. So we might be talking about people who work in the voluntary and community sector, who are trying to tackle some type of inequality, maybe health inequalities, maybe getting more resources around mental health. There was a person called Tara Mystery, who was a board member, actually, of a local clinical commissioning group, and she kind of took me under her wing for a while. I've also got to pay credit to Christina Gray, who is a white Scottish woman, but she was one of those really empowering managers who could see people's potential and would support you to try to develop yourself. And then there have been other people in different organisations, but certainly in my organisation it's been rare to find people who I can identify with at senior levels, but outside of my organisation it's not been that rare, so I've been quite lucky.
Thank you, David, and over to you please next, Elspeth.
Yeah, thank you. I thought this was a really interesting question, actually, and I have to say, to my shame, I haven't really reflected on it before. But it is true to say that very early in my career, when I was a management trainee, so not with the NHS, with the commercial sector, I very much identified with a senior director who was a director of HR at the time. And at that point, I think I started to shape my career into an HR and training and development portfolio, and in hindsight, you know, it's like the benefit of hindsight, isn't it? I recognise now that I obviously identified with her and saw that it was possible to work at a senior position as a woman, and have subsequently developed my career on from that. But I probably have to say that I haven't really considered it before, but now having that light shone on it from a perspective of being able to see people like you in a room, I can see that would have a massive impact on individuals, and so I've learned something. I think that's true to say. And one of the questions that somebody's asked on the chat was just about what we are doing as SCW to have a more diverse workforce. Now, I'm not going to go into any detail because that's clearly not what all of this conversation is about. But suffice to say that we are on a journey, and part of that is about helping our organisation understand where we are in terms of our diversity and plans that we must have in place to help develop that, because it's not my job, it's everybody's job to do that. And for me, it's about sharing data and information so we can see where the gaps are, and we can actually put things in place that close those gaps and actually make it easier and more transparent for people. We've talked about senior leadership, and having a more diverse senior leadership is something that we are aiming for. We need to think about the strategies and the actions that we put in place to do that. To say that we've solved it would be wrong, and part of that is also about joining up with the organisation and making sure that my ideas are not the ideas. It actually has to be a shared experience. It has to be from people like yourselves on this panel, and from other people in the workforce who can share their experiences and put forward their ideas that they think are going to make an impact and make a difference. Sorry, that's a slightly longer answer, but thank you, Asha.
No, it's all good. And last but not least, over to you, please, Ranu.
Thank you. So I haven't come across many people who I can, in senior roles, I can identify myself with. But I will say that when I started my career in NHS, and which was kind of my first proper job in UK, I was quite elusive and probably quite naive until someone from BME background said to me that if you notice around, you wouldn't see many CEOs or anybody senior around the trust in England with BME background, with diverse workforce. And I thought, oh no, I don't know what she's talking about, but it kind of hit me. And then I started consciously looking around, and I thought, yeah, she's quite right. But then when I started with SCW, in year 2011, it was still Hampshire IT Solutions. So I've been with SCW for a very, very long time. And in that period, I haven't seen a lot of women of color, but I have to say that in my previous role as the principal analyst, my team head was of that background. And so I thought that it's not a woman, but it's still a male, and he has been accepted. So it is doable. And I also believe that in my own experience at Omega House in Eastleigh, I do see a lot of people with diverse background in not so much as senior roles, but in different teams as senior analysts and principal analysts. So I think if they're allowed enough opportunity, then these people would progress and go into senior roles. So that's all from me.
Thank you, that's great. So we're just mixing up the agenda a little bit, you know, the beauty of live streaming. So one of the questions that's come in that I'm just going to cover is you know, what does it mean to be an ally? What is good allyship? And the Shuri presentation would have sort of lended itself to that. So I'm going to do that in a few minutes, but to sort of set the tone, allyship is, I like the definition of it being a lifelong process in which people with privilege or people with power basically work to develop empathy and support other underrepresented groups to support their challenges and issues. So it's about how, you know, bringing each other up and picking each other up. But we will explore sort of what the group's views and allyship are a little bit as part of the next question. So what we're going to do is we'll do the we had a few pre-planned questions, and I'll do the last one of those, and we'll explore that concept a bit more. We'll then talk a bit about the Shuri network, and I hope I can give it as much justice. I'll do my best, and then we've seen a few questions coming in for the audience, so we'll cover those off. So for now, I'm going to go for the question. Throughout the NHS, it is not uncommon to hear about the tap on the shoulder as being a way to progression, something which has historically not benefited BME staff and/or women. What does good allyship look like to you, which will help to change this culture?
Is that me first?
And it is over to David first.
Thank you. Well, I think, first of all, it's important to recognise the complexity of all of our identities. So, for example, you know, I identify as a man, I identify as straight, I identify as black. Obviously, within that blackness, there's loads of complications, etc., etc., etc. So we're all, you know, we've all got an identity in relationship to others on various parameters in terms of various characteristics. In terms of what good allyship looks like, in my view, it's about supporting people who don't share your privileges. And it's easy for me to focus just on what the needs of men are, or what the needs of straight people are, or what the needs of black people are. Allyship is not about that. Allyship is about stepping outside of your identity and seeing what you can do to support people who are less privileged, sharing different characteristics than the ones you possess. So in terms of what I'm trying to do at the moment is trying to seek more robust data, identifying which groups most need that tap on the shoulder. And in terms of good allyship, it's about, I think it's about making it your professional business as part of your everyday work to be interested in the progression of those from those groups that are least likely to progress. It's also about facing up to your privilege and using it in the interests of greater equality for people who don't enjoy your privileges. And like I have to keep saying, in some parts of your identity, you will enjoy greater privilege, and in other parts of your identity, you will enjoy less privilege. So it's about working through that. And it's about not being able to speak up on behalf of others, even at the risk of being challenged or criticised or ridiculed. There are people out there who will support you. So yeah, I think those are the main tenets for me.
Thank you, David. And same question to Preeti, please.
Yeah, you're right. I mean, most of us would have seen adverts for roles where we know that an internal candidate has already been slotted in, or you overhear managers saying that that last person was good for the job, but he's not a cultural fit, or some other reasons, random reasons. Equally, there are plenty of people who do see past gender, race, disability, or color, and generally try to learn about the person. So good allyship to me is when someone is trying to break the glass ceiling, your colleague, pass on the hammer, provide them the tools, encourage them, challenge your own assumptions and your own stereotypes, challenge others' assumptions and stereotypes. Don't be a performative ally, be a real one. Whatever your reasons are, you choose your reasons, whether it is social justice, whether it is fake fact based, or whether you want a better and equal future for your children. We all need to play a part. So I can, as David just said, we all need to be allied to our colleagues and friends. Thank you.
Thank you. And same question to you, please, Renu.
Thank you. So for me, good allyship is about recognizing everyone, ensuring they get the same sort of opportunities as other people, creating a platform where people can identify with each other and still have the same sort of like the courage to speak up for themselves. So it's about empowering them, making them a part of what everybody else is. So it's about the less privileged people being treated the same as the privileged one, but at the same time not making the privileged people feel a bit uncomfortable. So for me, that's the allyship, having having that great platform for unity of everybody.
Thank you. And same question next to Elspeth, please.
Thanks. I'm just kind of listening and reflecting on what people have been saying about allyship and privilege, and I think it's for me, the whole aspect of privilege is a relatively new concept, which, because we're starting to articulate it in a much more joined up way, I can actually recognise that I have a very privileged background, and as a result, that has meant that, rightly or wrongly, we can all be somewhat, not as aware of people who come from less privileged backgrounds and the impact that might have on their lives, and also their approach to work and the work that we do, and so on and so forth. So for me, it's a really educational journey, and allyship is a really important part of that. And the only way you can understand it is by speaking to people and understanding and asking about their experiences and their backgrounds. And for me, that means I can help and I can support by encouraging people to have those conversations that are really important, because they're quite challenging and they're quite difficult, because everybody comes from a different background and from, have a number of different characteristics around themselves that might influence the way they behave. So for me, in my role, being an ally is around supporting the organisation to have courageous conversations, and also to promote the understanding of people with privilege and those without, and how that actually influences people's experiences of the world of work, and what we can do as an organisation to be more inclusive, and put in place strategies that do make a difference, because recognising that not everything works, and not everything happens immediately either. This has been an issue that has been going on for many years, in all sorts of organisations, in all sorts of levels. So it has to be a concerted, pragmatic, and inclusive approach to deal with the problem. And for me, starting with conversation and education is the most important thing, and understanding, because when we understand, we can do something about it, and we can support, and we can make a conscious decision about doing something differently. So that's what allyship means to me, and how I feel I can support in that role.
Thanks, Elspeth. And finally, same question to you, please, Michael.
I'm just going to touch on the piece around at the top of the shoulder, because I do think that's a really important area. I'm currently reading a book by a gentleman called Daniel Kahneman. It talks about two systems of thinking. So it talks about one which is fast and based on experience, and one that is slower and considers broader circumstances. And I think as a leader, the tap on the shoulder is something that you do because you need to successfully deliver something. Normally, it's something you have to do in a short period of time, and naturally you start to think fast. And when you think fast, you go to somewhere that's comfortable, and somewhere that's given you outcomes before. And now, because you're making those very quick decisions, you naturally go into some of those spaces. So thinking really simplistically from my perspective, I think it's about thinking slowly, being considered when it comes to opportunity and forming teams. So thinking about the kind of horizon scanning of talent. So am I seeing as a leader enough from the people in the organisation to know about what they're good at, what their skills are, what they bring to the table, beyond what I kind of see in front of me. It's also thinking about very specific opportunities in terms of who really is the best individual based on their qualities, rather than what they've done in the past. And then it's also about looking at the kind of the makeup of a team. Is it diverse enough to be genuinely successful, considering the broader environment? And if it isn't, then you need to be really considering how you're forming that team to make that to make it as good as it can be. So in terms of being an ally, for me, I think it's about that continual education that we've spoken about. It's about using my privilege for positive, but also it's about being brave in calling out things that you see that make you feel uncomfortable. And I think at times as a white Anglo-Saxon male, I will see things that happen that maybe make me feel uncomfortable, but because I don't have some of the same lived experiences as others, I find it very uncomfortable, because I don't know if it's my space to say something or not. And I think I really reflect on the conversation that we had, Asha. One of the things that you said to me was, I'm really tired of calling out this sort of thing. We need more allies. We need people there when they see this to call it out and challenge. And so really that's one of the key things from my perspective, is taking that forward, being brave, and when you see things, making it your place, and not ignoring it because you don't feel that you can get involved because you don't have that lived experience.
Great, thanks for that, Michael. So, so we're just mixing up the agenda a little bit today. So I'm just going to give a little bit of an overview of the Shuri network on behalf of Rafia. I know Rafia is on the call, so I think Rafia, if you want to put any Q&A or comment, then please go for it, and I'll keep an eye on it. I'm just going to share my screen. Okay, is that working?
Yep, I can see it.
Yep.
Perfect. So, the Shuri network. Who are the Shuri network? So the Shuri network is the first NHS network for women of colour who are leading, involved with, or interested in digital health and tech in the NHS and social care. The reason it's called the Shuri network is after Shuri, the Black Panther character, who's the brains behind the Wakanda technological advancements. And I wouldn't be giving them justice if I didn't do the Wakanda thing, which I know they always like to do on their presentations. So that's sort of where the names come from, and you know who they are. So there's a pool of untapped talent who don't aspire to become digital leaders because they don't see anyone that looks like them in leadership positions. So this is very much what we explored at, at the start of this webinar. How do people get inspired and aspire to be leaders if they don't see anybody that looks like them? So who is the Shuri network at the moment? So the Shuri network was launched at Digital Health Summer Schools on the 18th of July 2019, so just over a year ago. And for anyone who was there, I'm sure you'll agree with me, it was absolutely phenomenal. You could hear a pin drop. The atmosphere was incredible. We had really, really powerful stories from the Shuri network, sharing their really personal experiences and why it's important we can support women of colour in the digital space. The network is sponsored by NHS Digital, Health Education England and NHS England as part of the digital Istanbul Digital Ready Workforce programme. And the membership is currently comprised of just under 3/4 of women in colour, but also about 25% of the network are allies. So they're people that are joining as allies to support those women, and then we've got 4% of other members. So what are the benefits to being a member of the Shuri network? Access support by finding role models, feel empowered to consider a career and apply for roles in digital health. So there's a lot about really supporting other people. I think Rafia might be able to take over, so we're just going to do a quick swap. Is Rafia on the line?
Yes, I am. Hi.
I'm going to hand over to Rafia because she will do a much better job than I can of this. So sorry, live tech.
I'm not sure I will. It took me a while to get on. The irony of being in tech. I'll try and take over where Asha was up to and perhaps put a personal kind of stance on it as well. So I guess there are benefits to being a member. I guess anybody, absolutely anybody working in the digital health space can and should be a member, because we are all committed to improving patient safety. And so the benefits are that it's open to everyone, it's an inclusive network. And once you're a member, you find role models, and I think Shira is really, really passionate about the fact of having that kind of open conversation with somebody. So having a role model that you can have a frank conversation with, and you can be honest with, and you can open up your vulnerabilities with, and know that it's a safe space, that you're not going to be judged, you're going to be encouraged and supported, and feel kind of the next thing is feeling empowered by having that safe space and being able to talk about your aspirations, and acknowledging that there's a ceiling there, and talking about how to work with allies to kind of break through that ceiling empowers people. It does empower people, and it encourages people to apply for roles that they might not have done previously. And then those people act as role models to other people. So it's a lovely cycle of support. And you can then bring that back. I mean, I absolutely have brought all the learning back to my trust. I'm based at St George's Trust in southwest London, and it's a very large trust, and it's a very diverse trust. However, the diversity, I would say, is absolutely, if you kind of picture the triangle of banding, it's very much towards the bottom, and as you go higher up the triangle, there's less diversity, which I think is a pattern that's replicated in a lot of places. So I've been able to take back a lot of the learning from Shuri Network directly back to my trust and embed practice as part of a project I'm involved with, where we feed back to the directors, exec directors of the board. So really, really powerful. It gives you kind of a narrative, and it gives you a support structure, and I guess a safety net where you can go back to recharge and then kind of feel kind of inspired and confident to make change. So yeah. Asha, would you like me to continue?
Yeah, I can keep going through the slides. Shall I go into the next one?
Yeah, is that all right? Would you like me to, sorry, I missed a bit of the start while I was trying to log in and log out. And yeah, so in terms of joining the network, so if you go to the website, again, absolutely anybody can join. It's free to join. The funding is it's a publicly funded body, and yeah, as it said, it's a ripple effect. So if you can get one person from your organisation to join, I think that person can then feed back and hopefully inspire other people, and more people can join. And then sending people to these events. So Digital Health Summer School, I wasn't there last year. I was very early on in my digital health journey, but I participated this year, and I didn't actually participate as directly part of the Shuri Network. I submitted a video diary, but it was so nice to know that the rest of the network were there and to share the journey. So I think it's really good because it's enhancing what you do already, but having that support structure there. And then the NHS Expo Heads event, I think the Rewired event we talked about as well. So it's just a really nice way of collectively increasing awareness. Yeah.
Rafia, thank you so much, and I'm so glad to see you here.
Took so long.
Okay, are you happy to just sort of share your personal story on the next few slides and what allyship is important to you? I'll keep driving, so that just tell me next and I'll move it on.
Okay, thank you.
And then we'll come back to some of the audience Q&A and close while we have time, if that's okay. Thank you so much.
Okay, thank you. I missed the start, so I'm not sure if Asha's done an introduction, but I'll just go through. So my name's Rafia. I'm a speech and language therapist. So I've worked in NHS for over 15 years now, supporting children with language and learning needs. And probably from about 6-7 years ago, I was interested in the role of technology. My focus is very much digital therapy, so digital as a tool to reduce barriers for children who turn into adults with additional needs. So think about accessibility. Next slide, I think I've started covering the next slide. So in order to develop this area of interest, I applied to the NHS for a fellowship, and a fellowship is a clinical doctoral research fellowship. So the NHS are currently funding me to carry out a PhD exploring digital therapy, and it's a great fellowship. It covers your salary, your training costs, conferences. It's a really, really, they really invest in you. And as part of that, I started that a year ago, and as you can imagine, as we moved into remote working, as an NHS as a whole, I very quickly became a person that people came to for advice and support with working in the tech field. So clinicians who previously hadn't worked in tech. So I was just slightly ahead of the curve from that respect, but also I was quite comfortable liaising with information governance teams and IT teams, and had private and public sector networks. So kind of because of all of that, it kind of led me to becoming a lead in the field of digital intervention as a speech and language therapist. Next slide, please. So just thinking about, I guess, taking it back a bit and thinking about diversity. So I don't know if any of you have ever come across a speech and language therapist. There's a fair few of us, but I think it's fair to say that as a profession, we are not the most diverse. So the slide on the left shows the diversity amongst students, and the green is white. So 79% of students, so this is the next generation of clinicians, are white, 3% are black, 6% are Asian, and the rest are other. But if you look on the slide on the right, I'm sorry, the percentages haven't come through for some reason, but you can just see the circle and what it's made up of. Majority of children with language disorder are from Black or Asian backgrounds, and that's not because English is an additional language, it's to do with socioeconomic factors. So language development is very much dependent on nurturing and stimulation. So in the early years, before a child turns 2 and develops a language, they need rich experiences, and that is a barrier for those who may not have as much money as others, to put it bluntly. And if you don't have as rich experiences, that affects the type of language that you develop, your vocabulary and the kind of experiences. And so people from a BAME background are more at risk of having a language disorder. However, they tend to be supported by clinicians who are not from the same background. And this is a real factor because, for example, thinking about vocabulary, a vocabulary of a person from a BAME background might be very different. So thinking about food is a motivator. We use food as targets. If someone's not from a similar background, doesn't have that knowledge, they'll be setting targets without knowing actually what's relevant to that family, or thinking of toys and ways of playing. So if you're not from a diverse background, you don't have someone that you can share knowledge with, and then the clinicians are going in and trying to support a population that don't understand. So there's just this lack of shared experience, shared knowledge and shared trust. So thinking about the importance of diversity for the patient experience, I hope this as a visual shows why it's so important. Next slide, please, Asha. Thank you. So I started as a clinician, obviously working in a field where there isn't a lot of diversity, and I've now moved into academia. And again, I think the stats speak for themselves. So there's over nearly 5,000 female professors and 25 are black. and that's the landscape. That's, you know, for me, that's shocking, you know, those kind of numbers. And also even thinking about the fellowship that I'm on. So it's NHS funded. So I'm funded by the NHS to do a PhD, aspire to become a professor. 125 people applied in the year that I applied. 2 BAME people were successful, myself and another person from a black background. I mean, that's so less than 2% of people are being invested in by the NHS to become leaders in this field. And obviously that has to change. I mean, that, you know, just looking at that, just the visuals, you can see there's a disparity there, and it's all to do with the ceiling and lack of mentors. I didn't have a mentor. I kind of just pushed and pushed and pushed, and it was challenging, and I just had to make my own journey to get there. Next slide, please. And then moving on to the tech world, again, majority of people in tech are non-BAME, and the majority of people in tech are male. So if you're a female BAME, wanted to work in the tech field in health, the odds are really against you. You don't have many mentors, you don't have many allies, people that have had similar experiences to you, and there's a real challenge. Next slide, please, Sasha. And really it's that drove me to approach the Shuri network. So I was part of a digital pioneer fellowship that I applied for, and that was led by an incredible lady called Yinka Makinda, and she led the program, and it was for anyone working in NHS who had a digital innovation idea. So I applied because I wanted to look at digital therapy. So this was before I got my fellowship, and then during that time I got my fellowship. But I was very aware that there weren't the diversity just wasn't there. So Yinka put me in touch with Shira, and Shira talked about her own journey and the barriers that she'd seen, and I talked about basically the slides that I've just covered with you, and how I was just looking for just, I guess, a diverse range of people that I could connect with. And this is what Shuri Network offered me: mentors, so people that I could talk to openly, talk about challenges, talk about things that I was facing. I have an incredible network of supervisors already, but this added an extra dimension that was a really supportive dimension. Also having role models, so people that were a few steps ahead of me in terms of their career progression. So knowing that this is something that I could aspire to, and I could watch the people on their journey and how they were going about it. And then social media has been fantastic. So please do follow the Shuri Network on Twitter, and you'll see they are very, very, very good at showcasing and retweeting. They've got several thousand followers, so they see examples of good practice and they'll retweet it, and suddenly a lot more people are seeing that. So I mean, it's definitely worked for me. They've absolutely celebrated any of my tiny achievements, and suddenly a lot more people are aware of it. So in terms of reach, they are fantastic. Next slide. I guess, yeah, so just to finish, I suppose, the ideal is to have true inclusivity. That's the best kind of diversity where everyone is involved. And I think that goes back to, Asha, what you were saying about allyship. It's this thing about, this is something for all of us. It's not a case of if you're from a BAME background, a responsibility of someone from the BAME background to change, sadly, what is the current kind of situation. It's something for all of us, because at the end of the day, we all support patients, whether it's directly or indirectly, and this has an impact on patient experience and patient safety. So in an ideal world, we'd all be working towards this inclusivity. Thank you.
You're on mute, Asha.
I thought it was me.
No, sorry, that's my fault. Thank you so much for that, Matthew. Great to have you with us today. We've had loads of great questions coming in from the audience, but we're getting a bit short of time. So what we're going to do is we're just going to pick up one of those questions. All the other questions, especially internal ones, we'll take back and we'll have a look at, and we'll share something with the recording perhaps. But one of the questions that I wanted to pull out, I'm just going to get it up on my screen. So I'd like to ask this question. I'd actually like to ask you, Rafia, first, please, if that's okay. So the question is, something I often hear, and this is from our colleague Zach, something I often hear is that if you are a woman or a person of colour, then to be able to make progress, you have to work twice as hard or be twice as good as the typical candidate when applying for jobs or high-profile projects promotions. Do you have any personal experience of this, or is it another urban myth?
I would say that's definitely the reality. I have had several experiences where I felt I've gone for jobs, usually jobs kind of that have come about organically. So somebody's left and an opportunity's come up, and I've put myself forward because I feel that I've got the skill set, I've got experience, and I've seen others with less experience be offered the job. And it's one of those things where you want to approach it in a really objective way, and you think, oh well, maybe it was this, that and the other, but sometimes it's a hard fact of actually no, I had the skills, I had the knowledge, I'm just not sure why I didn't get this job. And then what can you do? You improve yourself, you try and get yourself into a position where it's unarguable, where you take every opportunity you can get to get yourself to a position where you can't not be offered something. So for example, this fellowship that I'm on at the moment, it's the grant that I've been awarded is nearly £500,000, and it took over a year, and oh boy, did I make sure I was in the best position I could be to be successful. I did everything. I thought out of the box. I did things that other people hadn't thought of, but also I encouraged other people to, but I didn't follow the trodden path because I needed to stand out, and I knew that, like I said, less than 2% chance of being successful. I couldn't just assume that I've ticked the boxes, met the kind of requirements. I went out of my way to go above and beyond, and it does have an impact, and you do doubt yourself. You think you're putting all this effort in, will it pay dividends at the end? But you've got no choice, right? You kind of have to do it. So I would say, again, it's subjective, but my personal experience is, yes, I've had a lot of knockbacks where I can't really, sometimes you go for a job where, it's kind of, you're kind of just giving it a go. But other times I've gone for jobs where, I've been quite confident as I've looked through the personal spec and whatnot, and then just been really disheartened when the feedback doesn't match the reality, in my opinion. And so that's driven me to kind of just do as much as I can and maybe over exceed and yeah. And then there is that dilemma then of sometimes you feel that people are not giving you jobs because you're overqualified. So it's a bit of a catch-22, but I'm very happy with the position I'm in now. So it has worked in my favour. And the feedback I got, one of the reasons I was awarded the fellowship is because I was showing innovative practice and thinking out of the box and doing things and applying for things that hadn't been considered previously.
Thank you so much. And the same question to Preeti, please, and then we're going to start wrapping up.
Yes, unfortunately, it has happened with me as well. And it's maternity leave, which is in everybody's mind when they are trying to recruit a fertile woman sitting next to them. And in NHS, in acute trust, where they're already short of staff, they have to think twice. And it has happened with me, unfortunately. And you do have to work hard. You have to be doubly better than the next candidate if you're a woman and woman of color.
Great, thank you for sharing that. That's really helpful. So we just need to start closing, and what I'd like to do is go around everyone on the panel and a really quick sort of 20-second roundup. What action are you going to take away today following this session? And I'll come to David, Elspeth first, please.
Oh, I was hoping David would give me time to think about it, but never mind, that's fine. Just in terms of the challenge as a woman, or as a woman of colour as well, just in terms of that, I just wanted to say, as a working mother, I kind of absolutely understand some of the challenges that many of us have to face and have faced over our careers and so on. So for me, the thing I'm going to do, which I try to do already, but I will try and do doubly and do more of, is that I use my experiences to the benefit of everybody. So where I feel I have been treated badly, or I have maybe been given the opportunity that I could have been, I work doubly hard to make sure that the people who work with me and for me do get those opportunities, because that's really important, because that's the only way we can use our bad experiences to the benefit of everybody. I don't want to replicate my bad experiences with other people. I'd be horrified if I did that. It is really important that we reflect and think about our experiences and use those to everybody's benefit, to change that tone, to change that context. And that's something that I have tried to do and I will continue to do, as well as all the other responsibilities I have as the HR director in terms of taking that equalities and diversity challenge and agenda forward. Thank you.
And Renu, please.
So I will, when I'm a part of the BME group at SCW, which I believe is a kind of allyship for people of diverse backgrounds, so I will be introducing them to the Shuri network in my next meeting, and probably I will become a member of that as well. And I'm the kind of person, if I see anybody of any background being not treated well, I voice it with my management. So I think from this meeting, learning about other people's experience, I believe I would be more on top of that. If I see anybody not being able to speak up for themselves, I will. So thank you.
Great, thank you. And Michael, please.
Already signed up to be a mentor as part of the Shuri network, and really keen to kind of open that up internally to colleagues as well as encourage them to participate both in the network and the mentoring schemes. I think secondly, calling out and challenging things that I see or kind of think are happening that aren't kind of in line with all the principles that we've discussed today.
Great, thank you, Michael. And to you, please, Preeti.
So I would reflect on wonderful ideas shared by my fellow panel members, and I would also recognize my allies in my own team within CSU and outside, and appreciate them so they know what they're doing is consciously or unconsciously, what they're doing is having positive impact. And if I see any space where I can talk about it, I would do that, whether it is within CSU or outside. And above all, I would want to be and try to be a conscious ally myself to others. Thank you.
Rafia, please.
I'm so sorry, I missed the question because I was typing. Is it aspirations?
just quick 20-30 second, what are you going to take away? What action following today?
I guess that there's no such thing as one particular audience. This has shown, you know, this is a completely different network of people that from what I'm used to, but the language of good practice and inclusivity applies to all. So just being open to having the conversation and acknowledging that actually everyone wants to improve, and it's just about sharing experiences and sharing ways of doing it. So open-mindedness.
Thank you. And last but not least, David.
Thank you, Asha. Well, as the Senior Equality Advisor, I should know everything there is to know about inclusivity and such matters, but unfortunately I don't. So the thing I'm going to do is to keep learning and to keep sharing so that I can be a better ally and keep growing as an ally. Professionally, I'm going to support the production of better workforce data to help to identify those groups who most need that tap on the shoulder we were talking about before. And I'm also proud to say that SCW does have a positive attitude towards allyship. So I'm going to continue to support that, to encourage and support others on their own allyship journey as well.
Thank you so much, David. So we're just going to wrap up. I just want to apologise that we've run a few minutes over due to a few technical hitches, but you can catch the full recording hopefully. So really sorry about that. So just as a reminder, you can sign up to the Shiri Network either as a member, either as a woman of colour, or to provide support and allyship. The link is in the chat. I think my key take home from this session has been that this is all of our business and we've all got a role to play in this. So keep these conversations going, and I hope this is the first of many dialogues that we can have within SCW. The on-demand copy of the video will be available to you, and as I said, we'll have a look at the questions and what we can do about those. You can continue the conversation on Twitter using the hashtag SCW Digital. Thank you to all our panelists for being so open and honest and for sharing your experiences. And goodbye.
Thank you. Bye-bye.
Thank you. Thanks.